Hello everyone, welcome to this live session on breastfeeding and mental health. Now we have chosen these two topics together and these are very much correlated because many postpartum women in their postpartum period, like who are breastfeeding their babies, do face mental health issues. Postpartum blues is a very common condition that affects almost 70 to 80% of us. And we will have with us today Dr. Ruhi. She is a practicing psychiatrist. She practices in Mumbai. She will be joining us today to answer all of your questions. Free to post your questions, and we shall try to answer all of them. In case we are not able to answer any of your questions, I will be
I will be
up this video. There's
Hi.
the date
I-
actually.
Voice is like that only.
Yeah, can you just
Yeah,
go
can you
to
just
mute,
go
please?
to
Let me
please?
check
Yeah.
your. Yeah. So is it better now? Yeah, this is working well. Let Dr. Ruhi join and then we'll see if it's working well. Then maybe you can unmute only when you're talking. Yeah. Okay. So I'll just try getting in Dr. Ruhi. We already have some questions, the ones that you all have posted on the story. And hi, Dr. Ruhi.
Hi. Hi, how are you?
Good. How are
Good.
you?
How are you?
Oh, I'm
I'll
getting a lot from you guys.
Yeah, I'm muting. I'm muting.
Okay. Is this better?
Yeah. This is better,
Yeah.
right?
Okay.
Oh, okay. There's some issue in your
Try
thing.
removing headphones. I think that should
Yeah.
help. Okay, I got that. I got the time removed. Don't worry.
Yeah. Okay. So yeah, let's start with our session, Dr. Ruhi. But before, we start with the questions, it would be great if you can talk a little bit about yourself. I already gave an introduction about you, but if you can talk a few lines about yourself and also, why are we linking these two things together? Because breastfeeding in itself is a huge topic, and mental health in the postpartum period is again a huge topic. So if you can talk a few lines about it, I guess that would be a great start.
Sure. Thank you, Nilafar. Thank you, both of you, for having me. And this is a very not unusual topic, but this is a topic that is very less talked about. So first of all, kudos to both of you for picking this up, because we talk about everything related to breastfeeding and never talk about the impact of it on mental health, both on the mother and the child. So I'm really happy that we are talking about this today. I am Dr. Ruhi Satija. I am a psychiatrist and psychotherapist practicing in Mumbai. I am having my own clinic, Divine Mind Clinic, as well as I'm associated with Cloud9 Maternity Hospital, where I work as a perinatal mental health expert. And I'm a new mom, so now I'm on the both sides of the table. I am the one who has been treating people with perinatal mental health issues, and now I'm a patient as well. So I somehow connect with the emotions much more than I used to, because earlier it was more of my textbook knowledge and experience from other people, whereas now it's my personal experience as well that's going to add up. So I hope that I'll be able to connect on a bigger level with all of you. So, having said that, why we are talking about breastfeeding and mental health today, I'll divide this topic in two parts. The first is the mother's mental health, and the second is the child's mental health that we talk about. So, if we are saying breastfeeding, it's a very intimate process, it's a very emotional process. I'll start with a very cliche thing of saying, right? As women, we are very used to covering ourselves up. This is the first observation that I had with breastfeeding, that, whole of our life, we were like, okay, there should be no low cut, nobody should be seeing anything. And once we breastfeed, that's a first layer. You just forget about it, that where you are sitting or how you are sitting. The moment the baby needs you, you're like, go ahead, right? This is the first thing I observed myself, that okay, what am I doing here? My family is around and everybody is around, and the moment my baby cries, I'm offering my breast to the baby. Then comes the latching issues, because thankfully for me it was easy, but I know how stressful it is for the moms because the baby doesn't know how to latch properly. Sometimes we have some nipple infections going on, some diseases going on. They have extreme pain, which I experienced unfortunately in the beginning. So it was really painful for me, but we have to do it. And somehow that pain, I think, was much more than, let's say, a period pain. And when I had a period pain, I would be after my mom that, oh my God, what is this happening? But then when that is happening, I don't think even one day I felt that I don't want to do this. Because as a mother, you forget about yourself. That's where the mental health comes in, right? That I was able to overcome that emotionally more than physically. Physically, it was hurting, but emotionally, it didn't hurt much more, as much as should have. Otherwise, if I compare my past experience, I'm a really needy baby when that happens, right? Going to the next level, talking about the issues where people are not able to breastfeed for various reasons, right? Either the production is less or some other mental health issues going on or a physical issues going on where they are not, suggested that they need to breastfeed. What are the consequences of that happening? And then the positive aspect, that if a mother is breastfeeding, how does it impact her mentally? So this is some of the areas that we have to talk about with the mother. With a child, we talk about both biological and sociological and psychological consequences of breastfeeding. So this is how I would like to proceed. What do you want to hear first, the baby or the mother part? What are you more interested in? You tell me.
There was a question actually.
Sure.
Okay, there was a
Sure.
question from someone. I don't really remember the name.
Okay.
So the question was that I am like the lady who asked the question, she is breastfeeding, and she said that she is suffering with PPD. So
Right.
that was like it was like more of a sentence kind of a thing. So maybe like because of PPD, it's impacting her breastfeeding journey, and maybe she was
Right.
looking out for a solution for it.
Okay, wonderful question. So let's talk about the mother first. Okay. So it is known that biologically speaking, when we breastfeed, there are two dominant hormones that are released in the body, which is oxytocin and prolactin. Okay. Both of them are nurturing hormones as well as they reduce the level of stress and anxiety. So if I have to connect it with postpartum depression or anxiety, these both hormones are known to reduce the stress level. If they're reducing the stress level, they're automatically preventing some chances of a mental health issue to occur. That's one part of the story. But if you already have postpartum depression, anxiety, or any other mental health issue going on, at that moment, if you breastfeed, there are two consequences to it. One is biologically the milk supply reduces with the depression. Second part is it is more stressful because you yourself do not have the capacity to take care of you. At that time, if you're putting the stress of breastfeeding, you have to take care of the baby. That can be counterproductive to the mother, right? Third thing is if you are on some medication for your depression, not all, but some medication, naturally, of course, if you are in touch with the psychiatrist, they are definitely going to change it to the safer medications. But if you haven't consulted the psychiatrist and if you're continuing the medications that you were taking even before, it goes in the breast milk, which is of course not healthy for the baby. So we suggest that either we switch to the baby safe medicines at that time or you stop the medication. So you need to consult your psychiatrist. This is the mental health issues part. Then we talk about the breastfeeding part. But if you talk about normally also, anyways pregnancy is stressful, then delivery is even more stressful. Breastfeeding is known to reduce that stress. Okay. It reduced, and there's a biological reason to it. It's not just emotional because we are feeling good. Oxytocin releases a catecholamine, which is basically the stress hormone. Then it also affects the vagal nerve, which is basically the nerve that causes the stress reaction in the body. So it soothes that nerve, and basically what was causing anxiety, that stimulus itself is gone. That biological reaction itself in the body is gone. So you do not feel that stress. It is known to reduce stress in healthy females. But if you have an issue going on, if there is less production for some other reason, or if there is something as other biological issue going on, it is advised that if it is taking too much, sometimes what happens is if we stop suddenly, there's a lot of guilt. There's a lot of, feeling inadequacy in the mothers that I'm not able to provide for the baby. But that's the, beauty of humanity right now, that we have found the formulas. We have found so many alternatives now, and that's also humans. So just because I always tell them that if you have this thought that you are inadequate because you're not able to breastfeed your child, itself shows me how beautiful of a mother you are. Because if you were not concerned, you wouldn't have this thought in the first place, right? Just that you have this thought that I am not good enough shows me how enough you are. So that is how you need to see it. Every mother is different. Me and my sister both are doctors. She chose to stop breastfeeding after 1 year because she was having health complications because of it. My baby is 1.5 year old. I'm still breastfeeding, and morning and day. I haven't reduced it yet. So there is no right and wrong answers. People tell me it's already late, you need to stop. Somehow my instinct tells me that no, I need to continue. And I'm doing that. Right? So it is not what happens to my baby because of it. I'll talk about that in some time, but biologically, definitely it's a wonderful time. I get to spend that time with my baby. Otherwise, my patients wouldn't leave me. They know that I'm busy. So, they are very courteous and very nice to me that we know that she's a new mom. It's okay. We need to give her time. Socially also, you get so much support. And if you're not breastfeeding, we have all this stigma associated. It's not just the female who feels like that. The family members, or the society, the neighbors, everyone has an opinion about their child. They will tell you that you are doing wrong to them. Biologically speaking, of course, till 6 months it should be exclusive breastfeeding. After that, it should be breastfeeding plus formula or whatever food you're giving. But everybody is different. If you're not able to breastfeed, it's absolutely okay. You can feed whatever you can. Be with the baby. It is more of the nurturing that you are giving to the baby that will be more important in the long run than just the breast milk that we are talking about, right? So definitely, I am not going to ever say that the breastfeeding is same as, formula, the nutrition is same. Of course not. Yes, biologically, breast milk is definitely superior. But if that's not possible, it's not the end of the road. It is not the end of the game. It's okay. Find a good formula. Love your child as much as you can. That's more than enough. Okay? That's the
Thank you so much
mother's
for
part.
that, Dr. Ruhi. Yeah, that was
Most
like,
welcome.
it covered so many things. It covered a lot of things. We have
Thank
one question
Sure,
from Monica.
sure.
Hello, I'm not able to feed my daughter. She vomits out every time. My in-laws are giving her cow milk. Oh my God. Although she drinks it very well, but today since morning the color of her stool has changed.
Yeah.
She's not
So you
written the
need to go to the
age of the
hospital
baby.
immediately. That's okay. If the color of the stool is changing, you need to go to the hospital immediately and get it checked. Okay? Cow milk,
Oh,
it's very commonly used, but actually it's really heavy for the baby's intestine. So if you're diluting it, it's still a little acceptable, but please go and get it checked.
but she has not written the age of the
Yes,
baby.
1 month,
yes,
1 month.
1 month. Yes. So
Yes,
see, if the baby is 1 month, no matter what is happening, first of all, the moment you see some physiological change, which is, for example, in your case, you are telling me that there is a change in the stool color, you need to get her checked. Okay. So breastfeeding cow milk is a later problem right now. First, you need to get a stool test done and check why the stool color
yeah,
has changed
yes,
and get it
yes.
checked.
Yeah, Monica, please do that. She has
Yeah.
written that the color of stool is white, which is not
Yeah.
fine.
Not
No.
okay. Yes. Yes.
And also, like, since we are on this question, Vidya mentioned that the baby is 1 month old. I didn't read it. So,
No, she
1 month
messaged
old
late.
baby should ideally not be fed cow's milk, right?
True. But it's a very common practice that if they are not breastfeeding, they prefer cow milk over formula. So in the tier 2 and 3 cities, and even, it is the cultural aspect of it that if somebody is not able to breastfeed, they prefer cow milk. It's not a very good idea, but then, each to their own. But please get it checked. If the color of stool is changed, you need to get it checked.
Okay, the other question we have is not related to breastfeeding, but I'm still going to read it out. What should be the schedule for a newborn baby? If baby is asleep for more than 2 to 3 hours, should the baby be fed?
No, don't wake up the baby for feeding them. They are sleeping because they are full. Newborns are very, very smart. If they are hungry, they'll wake up. So the schedule initially, at least for the first 3 to 4 months, should be as much as they need. Whenever they ask for it, you need to feed them. That's how it goes. And then slowly you start scheduling it that every 2 hours, every 3 hours you give them so that you have little bit of, at least especially at the night, it makes it easier that you feed them a little earlier so that at night you don't have to wake up too much. but there is no such thing as, keeping it that even if they are crying, you don't give them because it's not according to the timetable. That's not a good idea. As much as they need. Whenever they ask, you feed them.
When I feed my baby, I always feel thirsty. Is it normal?
Yes, it's absolutely normal because there's a lot of water that goes on in production of the breast milk. You need to hydrate yourself really well. Whatever you consume, at least add a liter to it. Have more water. It will help in the milk production, increase the volume, of course, and it will, of course, take care of you also, because a lot of nutrition and water from our body goes to the breast milk and then we get deficient. So it's normal. Just have it. Only thing, just a word of caution I'll add here, that if you are feeling that you are really thirsty and drinking all the day and peeing a lot, just get your sugar level done, because sometimes polydipsia is one of the symptoms of diabetes. And in pregnancy, we know that, there is something called as gestational diabetes. I think you did a session on that as well. If you don't have any other system, don't worry, just start drinking water. But if you think it is uncontrolled and you are then drinking water and then peeing a lot, maybe just get a RBS done and that might help.
Thank you, Dr. Ruhi.
Yes.
Next
Fine.
question. I have to go to work soon, and my baby is just 3 months old. Since I'm a doctor, I'm not able to take leave. Being a doctor myself, I regret this. It is very depressive that I have to leave my baby and I can only feed him at night.
Yes. So I understand your sentiment as well. And it is a very difficult decision. And being a doctor, I can understand. I actually made a choice to reduce my practice. I was in private practice, not in job. So I had that choice. I did actually do that I stopped going to I have 3 hospitals and I only go there once a week, where I should be, there every day. But I chose that consciously because I wanted to spend time with my baby. So I absolutely understand your sentiment. And then being a doctor, everyone tells me, because even if I'm working from home, I do overwork. So I do get this statement that you need to stop, working that much. But, like I said, that being a doctor, especially, I think it is ingrained in us that we can't stop. And then we always have this dilemma that, where do we draw a line? So if you are not absolutely comfortable, and if it's a job, to be honest, you'll find another one. If it's making you miserable, just take another month. But to be honest, the day you will decide to leave, you'll have the same guilt. The more time you spend with the baby, the day you leave, it is going to be there. But yes, right now, if the baby is 3 months, my personal opinion would be that spend a little more time with the baby if possible. But of course, for everyone, that doesn't work. So, and if the feeding is the issue, that's okay. If you're feeding at night, he's already 3 months, I think it should be okay. What you can do is use a breast pump. Just, keep the breast milk frozen, and then whoever is at home, they can, warm it and then give the baby that. You don't need to switch to formula if that is one of your concerns. You can easily store your breast milk up to 24 hours. And somebody who is at home, just ask them to make sure that they are being using the sterilized vessel. You can get a machine for that. It's very easy now. So just sterilize your bottles properly, warm the milk, and at least the baby will get breast milk. You won't be feeding them directly, but at least the baby will get the diet that they want. So I understand your emotions, but if it's bothering you too much, maybe, have a hard look. A few more months of not working, I don't think. Anyways, there are less doctors in the country and the economy is like that. So it's okay. If one less is there, anyways, everyone is suffering, they'll suffer a little more. That's okay. Think about yourself. I would say that.
Thank you so much, Dr. Ruhi, for that. Yeah, I'm
Yeah,
just trying to find out some more questions. There were few questions on the story, so I'll just pull out those. Yeah, there's
sure.
here. How to get a good latch during breastfeeding? I have been facing severe nipple pain during breastfeeding. Vidya, did you zoom in or something?
I don't know how this happened.
Because I thought I did something.
Okay, no, you are looking very pretty. That's okay. All right. So coming back to the
I don't know how to come out of that.
That's okay. We like you up and close. That's okay. I'm just worried now this shouldn't happen to me. That's okay.
Sorry, I'm not laughing at you now.
Yeah, no, we're just yeah, I get that. Now we are on mute. Vidya, it's worse than that. At least keep the volume on.
Yeah,
Or
yeah. I'll just read out the question again.
no, I remember the question. I read it. Don't worry about
Okay.
it. So the question was that she's not able to latch. First of all, I would like to know the age of the baby. If it's like the first, first month, it takes time sometimes, and it is like I said, even I experienced the same. It was really painful in the beginning. It gets better with time. The pain is because that the pores are still clogged, and when the baby is suckling, they have to add a little bit more pressure to get the breast milk, but it's not happening. That is why the pain is there. If it is longer than that, if it has been to, yes, 10 days old now she's mentioning, so yes, in the beginning it does hurt. If it is too much pain, please ask your gynecologist. Maybe they can give you some painkiller for the time being, because that might help it. But yes, for some people it is painful, but it gets better within a few days. So if it's just 10 days, it will take some time. I'm sorry that you're going through that. I know how painful that is. But definitely, if it is unbearable for you, talk to your gynec. They'll prescribe you some medicine for it. It will help.
Yeah, thank you, Dr. Ruhi. I'm just
Yes,
trying to find out how to get more milk during expression of milk. Are there any chances of overfeeding a baby while breastfeeding?
no, no, no. The baby is much smarter than us. That's what I always feel, that somehow, the society dumps us down, but the babies are born really smart. They know what they want, they know when they want it, and they know how to get it. So don't worry about it. You're not going to, at least if you're not forcing your baby, you're not going to overfeed them ever. So don't worry about it. Just don't
Yeah.
force your baby, because I see that very commonly happening and being suggested to new moms that, कम है वेट कम है पतला सा बच्चा है इसको फीड करो फोर्स फीड करो now they are like they are too small to resist, and I see that happening very often, that they force feed the baby different things. Please don't do that. There's a whole reason behind it. It's not just about overeating that the baby will do. If you are forcing the baby, they are crying, and if they are stressed at that time, even if they eat, it's not going to be of any use, because you're basically making your baby stressful and anxious, and the biologically the food won't be digested and of any use. So don't do that. Don't force your baby for eating anything. With time, as they want, they will do it. Yeah.
Thank you, Dr. Ruhi.
You're welcome.
I'm really not understanding how to zoom
Okay,
out.
the Vidya, you have to go on.
Yeah, sorry.
Yeah, the question that we had earlier on the person who was a doctor, she just commented again saying, "I'm a postgraduate, ma'am. I won't be able to leave it." Yeah.
I get that. So that's what I'm saying. If it is inevitable, all you can do is, I can understand how tough it is. PG is horrible, and I really empathize with you right now. So what you can do is, at least the time when you are with the baby, spend that time with the baby. Make sure that that is, and anyways, as a doctor, we need to have that, because of course we won't be there for our babies as much as a stay-at-home is, and it's an ever going pain. I know it's been, my baby is 1.5 years and still I'm not able to go back to work. So I
My
can
baby is two and
understand
a
that.
half year and is still not able to come out of that case. So that will never go. Either
That
whether
will
the
never.
baby is 3 months, 3 years.
Yeah. So it's not about the baby's age. It is about the fact that now you are a mom, you're always going to be a mom, and guilt comes as a gift with that. So don't worry about it. The best thing that you can do is, when you are with the baby, be only with the baby. I make sure that when I am with the baby, it's a phone free time. I literally, like, I hired an extra assistant just to make sure that, I don't have to take those extra calls. And I'm very happy with that decision. So when I am with the baby, it's a phone free time. Only I have a like personal number where my family can call me. Otherwise, I don't care where the world goes at that time. So I think that strategy worked for me really well. So he knows that when I'm there, we are going to do fun things together, and we have our own rituals that we do together. So that works. So don't worry about it. It's not about 3 months or 6 months. Yes, he is young, but then you're a doctor. You can't forget that. You chose that. Your personal life is not important. That's how it goes with doctors. What to do?
Yeah, there's another question. How to cure sore and cracked nipples? My baby is 1 month old. Doctor advised to give rest to breast and hand express the milk.
Yeah.
Doctor also have prescribed antibiotics and nip care, but no help from nip care. Please advise.
Okay, so first of all, if you already have those cuts happening, it is going to take some time to heal. Any cream that you apply takes at least a week's time. So if they have already given you some antibiotic cream and some, those nipple creams, it will work with time. Don't worry about it. And also you are taking medicine. So medicine, antibiotic has a whole course, how it works. So all you have to do is wait for it to get better. Definitely do not feed from the baby's mouth. Hand express, that's a good strategy to go. If it's really painful, you can take a painkiller along with that, but it will take time to heal if it has started cracking. Once it gets better, make sure that you regularly use a nipple cream, so that will prevent it from happening
I
basically.
have a question, Dr. Ruhi. Because I've done it, I've actually observed it for myself. My breastfeeding journey was, touch wood, pretty easy. Like it was pretty smooth. It started well, it ended also well. I had very brief period of time when I had some issues with nipples, and the only thing that I used was the breast milk itself. So I just used to dab some breast milk on the nipple. It worked for me. Yeah. So is it is it helpful? Has it been proven, or it's just
Yeah.
yeah, it's
Yeah,
just
no,
a
there
myth?
are actually studies that says that breast, because it has natural anti-inflammatory and those immune cells to work. Even sometimes they say those diaper rashes that the babies have, even on that they apply breast milk. Okay, for my baby that didn't work, but apparently it is. Second thing is ghee is a very good solution. The ghee, like homemade ghee,
Yes.
proper, not the store bought, that also works well. But then again, I would say it with caution that the thing that she's talking about, it is infective, so for her,
Okay.
it's not going to work,
Okay.
right? For you, maybe it was just, a little bit of erosion because of the latching and the way the baby was feeding. That causes some friction that must have caused it. So it got better with the breast milk. But if it is, and it is not just, the cracks are not just because of pinching or the bites that the baby does. It can be an internal infection going on. So it's important that you get it tested with the doctor. That if the reason
Thank
is different, so that is why the treatment is different.
Okay, thank you for that. Okay, there's a question how to share link of this live on WhatsApp. So we will be uploading this live session on our feed, and from the feed you can just click there are three dots on the right end. So just click on those three dots. You'll get the option of copy a link or share on WhatsApp. So you can do it once we have posted this live session. We will be doing that immediately after we are done, after the session is over. Um, just looking for, I missed a few questions.
No,
How can I, okay, the question is how can I stay happy in my postpartum period? Yeah, I guess that's what she's trying to ask. And remedy for nipple cracks. Nipple cracks, I guess we already discussed. So maybe we can answer the first
so
part
how
of the
to be
question.
happy in postpartum or forever is self-care. Happiness, I feel, is a choice and a very misunderstood term. First of all, with happiness, it does not mean that every day you'll be chirpy and cute and dancing on your toes. That's not how happiness works in life. It comes in bouts, and if it's not coming from outside, expecting from the husband or everybody else, you need to start creating it for yourself. I think we will need another live because it's a huge. I actually have a course on happiness. If you are interested, you can just do that. I have an online course on how to create
Wow.
happiness for yourself. So you can do that. So, in simpler terms, what you need to do is start with self care, do things that make you happy. Take some time off for yourself every day, even if it is just a half an hour. Do something physically moving, that helps. Eat right. Nutrition definitely adds to happiness. It helps to keep you stress free and full, and that helps. Do some activities that make you happy. Even if you have a baby, doesn't mean that you can't have your own time. Once your baby is old enough to live with somebody, just go out for an hour, for a walk, for a swim. That makes you feel a little bit lighter. And don't forget that you are a human being as well and you have needs. So yes, we have a baby, but we are living beings as well. We have a heart that needs to be taken care of.
Thank you, Dr. Ruhi. Yeah, actually, really, like as Dr. Ruhi said, it's not the thing that, you can expect from somebody else, from your husband or your mother or anyone else for that matter, that with because of that person, I'm feeling happy. You need to find it for yourself, and everyone has something or the other that makes them happy. The only thing is that you have to just sit down and realize find it out for yourself. Maybe now you are like, so stuck that you're not finding that moment, but there must have been moments in your past wherein, like, you experienced that happiness. Maybe just by watching the sky or stars or clouds, or like, it can be very simple. So find that out. Yeah, I guess we are done with questions because some questions I've missed. And yeah,
We can answer them later in written form if
yeah,
they. That's okay. All right.
yeah, it
Oh,
was a
we cover. We had some questions on stories.
I asked them.
Okay.
All right. Perfect then.
Yeah, thank you so much, Dr. Ruhi, for joining us. And sorry, this zoom out is not at all
See,
happening.
this is better. I can see you clearly now. You all should zoom in.
Okay.
This is
I
better.
feel bad for the viewers. Okay.
No, it's not bad. Like, it's just funny because it's all sudden and what are you doing? Like that.
It would have been
Yeah.
bad if mine zoomed in.
And
Otherwise,
thank, thank you so much for joining, Dr. Ruhi. It's always a fun session. I mean, with information, but it's a joyful session with you. Thank you so much.
Thank you. Thank you for having me.
Yeah, bye.
Thank you so much, Dr. Ruhi. And even if you are watching the session later on, if you all have any questions for Dr. Ruhi, just post it in the comments, okay? If you all message me, then it's a bit lengthier task. I have to copy the message, I have to send it to Dr. Ruhi, then I have to send your profile to Dr. Ruhi, and then she will be answering. So it's better just post your comments on this session, and Dr. Ruhi herself should be able to answer them. Thank you so much. It was a lovely session, as always. And yeah, see you again soon.
Yes. Bye.
Bye.